Malnutrition is often silent, driven by poverty, illness, and limited access to care. In Oyo State, Nigeria, recent findings show that thousands of children continue to live with its consequences. This is the story of how the Nutrition Support Center NSC Oyo State responded, not only to treat malnutrition, but to understand it, reduce it, and prevent it. Across health facilities, repeated cases of wasting, underweight, micronutrient deficiencies, and nutrition-related complications were recorded, many presenting late when recovery is harder and risks are higher.
If it's for children, definitely micronutrient deficiency, because most time we say that the child is severely anemic, whereby the child will require blood transfusion. So aside the severe acute, definitely micronutrient deficiency.
NSC responded by embedding its work within the existing health system, partnering with the 5 primary healthcare centers and 3 general hospitals across multiple local government areas. From the start, beneficiaries were systematically screened using standard anthropometric tools, including MUAC, weight for age, and clinical assessment. Screening took place at both community and facility levels.
Hi, my name is Mary Alpha. I'm a public health nutritionist and a volunteer at Community Port Ayeye. I joined Community Port because what they do, that is improving nutritional status of children and their overall well-being, aligns with my passion, because as a nutritionist, I have come to see that malnutrition is a menace in our society, and then whatever we need to do to combat the effect of this malnutrition, it should be done.
Through these health facility partnerships, NSC leveraged routine immunization and antenatal clinic days to reach mothers and children at scale. What emerged was concerning, though expected. A high number of children presented with moderate acute malnutrition, while a smaller proportion showed severe acute malnutrition, often alongside infection, food insecurity, and suboptimal feeding practices. Many caregivers also lacked practical knowledge of age-appropriate feeding and nutrition during illness.
Mostly within within 1 to 2 years of age, is very, very rampant. Very.
These findings guided every intervention that followed. Children identified with acute malnutrition were enrolled into structured care in line with national guidelines. Support included ready-to-use therapeutic food, micronutrient powders, protein supplements, and medical referrals when required. Progress was closely monitored, tracking weight gain and appetite, providing many families with their first experience of consistent, structured, and accessible nutrition care. But treatment alone was not sufficient. Using the same antenatal and immunization platforms, NSC delivered practical behavior change communication focused on dialogue rather than instruction. By the close of the pilot, NSC Oyo State highlighted clear lessons. A total of 136 children aged 6 to 59 months were screened, representing approximately 90% coverage of the target communities. 59 children were identified with malnutrition, including 18 cases of severe acute malnutrition, 22 cases of moderate acute malnutrition, and 19 borderline MUAC cases. All identified children were enrolled for follow-up and care. 15 children recovered and were discharged, while 27 children remained in active treatment at the close of the pilot. 17 children defaulted from care, representing a 28.8% dropout rate, largely due to access and caregiver time constraints. Among enrolled households, meal frequency increased by 100%. Continued breastfeeding was observed in 50% of children, and caregivers demonstrated increased interest in complementary feeding. 90 community volunteers were mobilized, with approximately 53% actively supporting screening, counseling, follow-up, and data collection throughout implementation. Malnutrition is common but reversible. Early detection saves lives, and partnerships with existing health facilities significantly increase reach, trust, and impact.
Most of our patients that we use the incentives from the NOC, like, they tend to improve because it's free. So those people tend to come when they are expected to come to collect it because they know that they're not paying for it. So they tend to adhere to the instruction and to the feed given to them. So yes, they've been very, very, very helpful.